Hello, welcome to Your Health, Your Life. Today we're going to be talking about arthritis. In particular, we're going to be talking about a special type of arthritis that is called rheumatoid arthritis. Now, rheumatoid arthritis is a type of autoimmune disease. By autoimmune, we simply mean that your body produces soldiers that instead of fighting off bacteria, viruses, and other bad things that you have, decides to start to fight off the joints that you have. So the joints have a space called synovium, alright? So the body starts to produce soldiers that go in and start to damage those cells in your joints. And then all of a sudden you start presenting with joint pain and joint swelling. Now, rheumatoid arthritis is very special in how it presents. It has a very unique presentation. For most patients, which is the classical presentation, they're going to present with swelling involving the smaller hands, the smaller fingers of the hands, the smaller joints of the hands, alright? Mostly the fingers, on both sides. So we usually say that it has a symmetrical distribution. For most patients, they will also have some wrist involvement, elbow involvement, as well as shoulder involvement. Typically, this swelling or joint pain seems to get worse in the morning when the patient mostly wakes up and then sort of improves as the day goes by. That's usually the story that the patient is going to tell you, and that is something that you may experience. So if that is something you're experiencing and you're female and you're elderly, because rheumatoid arthritis usually happens in the old, you may want to go to the hospital to get screened. Now, it's very important for us to get the distinction between rheumatoid arthritis and any other type of arthritis, because rheumatoid arthritis needs specific drugs to be used, and those drugs actually help to prevent all those symptoms. The problem is, if we don't use those drugs, patients with rheumatoid arthritis eventually start having joint abnormalities that may not be reversible. So eventually, if you don't get the treatment that you need, if you have rheumatoid arthritis, you may get joint and bone deformities, and those may not be able to be repaired with drugs. So we don't want you to have rheumatoid arthritis. So if you fit the description of what we've mentioned here, small joint involvements in the hands and in the feet, swelling, pain in those joints that is worse in the morning and gets better during the day, please find time to view us the nearest fertility and get yourself screened. From Your Health, Your Life, have a good day.